Hello, and welcome back to another episode of the Creative Legacy Art Podcast. My name is Amanda Downs, and I am your host. And today is the fifth episode of the podcast, and we have a very special show today and a very special guest, Mr. Daymond McDuffy, Dr. Daymond McDuffy, and he is a medical director for a hospital here in Nashville. He is also my classmate from the Austin East High School in Knoxville, Tennessee. So, without further ado, here is the episode. Enjoy. All right. So today we have Mr. Daymond McDuffy, and I'm so thankful that he came and gave us his time today. Could you tell us about yourself and what you do?
Again, I'm Daymond McDuffy. I'm from Knoxville, Tennessee. I had the honor and pleasure of knowing Amanda back at Austin East High School, where I graduated from. And I'm married and have two kids. I started my journey after graduating Austin East High School and went to Morehouse College. There, I majored in biology and completed 4 years there. And during that time, I did many summer programs and also worked at a hospital back in Knoxville on my summer breaks to prepare me for medical school. I did graduate Morehouse and then transitioned to Meharry Medical College, where I finished that degree in 2005. And at which point I then decided that I wanted to go into rehabilitation and sports medicine at the time. I went to the university. Well, actually, I did an intern year at back home at University of Tennessee, Knoxville, at the hospital there, where I completed an intern year. And from there, I went to the University of Louisville, where I completed physical medicine and rehabilitation residency program. That was a 3-year program that I completed, and then with an interest in sports medicine, I went to the University of Kentucky and completed a 1-year sports fellowship there. Um, and I think that was at the same time where, John Calipari, who's been in the news with the NCAA tournament going on, they started, and there were a lot of, now professional ball players there who I I guess, the luxury and obviously working with and just beginning to start that journey on building that experience. From there, I actually graduated there and went to Atlanta, where I became actually assistant medical director at an inpatient rehabilitation unit in Marietta, Georgia. It was at that time that I began to learn that I had more of an interest in providing hospital care versus continuing sports medicine and being a team physician, which I had that experience during that fellowship as well as residency. And after I think 3 years in Atlanta, I then moved to Nashville, where I became the medical director for an inpatient rehab unit in Hermitage, Tennessee, which is TriStar Summit Medical Center, where I remain the current medical director today.
That's awesome. That's awesome. So you had a extensive background with that.
Long ride.
Yeah, yeah. And so just to tell the story about how we reconnected was a little bit over a month ago. I had a personal experience with a TIA, which is a mini stroke, for, just a easier way of putting it, because I don't know what TIA, I can't remember the
Transient ischemic attack.
Okay, yes. So that's what happened to me, and it was a very scary experience. I've actually have had a couple of more since then, but I was being wheeled in a being wheeled in a wheelchair down the hall to my room, and I see you, and I'm like, I know him. I know him. I went to school with you, and you stopped and you talked to me for a minute, and you know I just really want to say I appreciated that. I appreciate you even came and visited me while I was admitted in the hospital, and I appreciated that. I was by myself. I didn't have any family there. I had my children, But it was just a brighten that brightened up my day. That was a good thing to have somebody there to, just give you some encouraging words, help you understand a little bit more about what's going on, and it was a really good thing. And so I started this podcast because I wanted to. Um, Really, I started this podcast because I needed to create something. I was just going through a depression, but it turned into something that I hope that can be a resource to anyone, not just artists, but anyone who comes across it, that they could get more information and more resources to help them in their journey, whether they're feeling stuck in their career, stuck in their life, or just stuck in their medical situation. As artists, we are people, and we go through life circumstances. So I thought this would be a great way of getting information to to people who are going through some things. So my question for you is, can you tell us about, like, what does a day look like for you at work?
Yes. So, being the medical director, I have lots of responsibilities. My job is really like 24/7, so I'm sort of available at all times. Just because I want to be there for my patients and my staff. And so when I wake up in the morning, it could be with, text messages or phone calls, depending on what's going on with patient care. But I start even then with doing what I can to help whatever's going on. Ultimately, once I do arrive to the hospital, I'll actually go to my office first and go through and actually I can look at labs and blood work as I'm traveling into the hospital. So already actually working in my commute to the hospital, but still just want to prepare for all my patients. So making sure I've looked at any results or lab work or vital signs as far as blood pressure, so I'll know at least what we off with discussing before I even see you. But then ultimately, I'll go ahead and do my rounds and actually speak with them and see how their night went and see how they're feeling in the morning, and address any questions or concerns or any new problems that they may have. With me being in a rehab unit, which is again a unit comprised of myself, nurses, therapists, case managers, even the environmental people who help with keeping the rooms and the floor clean. We all work together to give the patients the best care that we can offer. And so, working with a team, because I'm only one person, I utilize, all my other team members to be my eyes and ears wherever the patients are at, just so we can make sure we're addressing everything, all the I's and crossing the T's. And it's through that, teamwork that we're able to provide really a lot of great patient care. Because again, like I said, I'm only one person, and ultimately, I need all these eyes and ears to make sure we're not missing anything and make sure people are actually getting better, so they can go home and continue to get better. So, talking to all the team members, talking to the patients, making sure we address all concerns, new problems, and make sure the patients are and families know exactly what the treatment plan is for that day. We do that before I leave that day, knowing that even after I leave, I still may be addressing questions or addressing any medication changes that pertains to those patients. And those are just the patients that are still on my rehab floor. I still, will discharge people who are ready to go home in the morning so they can get home, and so admit new people who are coming in, getting their rehab journey started.
Okay. So for people who don't really know, can you explain what is the rehab? What does that mean?
Yeah. Yep. So again, I my specialty is physical medicine and rehabilitation. And again, I work in an inpatient rehabilitation unit. We as a rehabilitation team, again, comprised of therapists, nurses, case managers, psychologists, hospitalist medicine doctors, pharmacists, respiratory therapists, just everybody. We actually treat patients who have been hospitalized for significant diseases or injuries, and help them regain, their strength and endurance, and just function. Rehab is about restoring function. So typically, we see patients who have lost functions related to some sort of injury, like hip fractures or multiple fractures for people who've been in car accidents, but also for people who've had strokes or brain injuries or spinal cords who can't do the same things they were doing before coming into the hospital. And it could be as, young people who are students, could be middle-aged people who are working, or older individuals who have been retired. But nonetheless, when things happen that you don't plan for and it affects our lives in a major way, obviously we are there to help them try to return back to some of those normal activities with some of the impairments that they've sustained from those injuries or diseases.
Yeah. Okay.
And
So
so, and just to elaborate further, because with physical medicine and rehabilitation not being one of the more sexy specialties like cardiology or orthopedic surgery, a lot of people again don't know about inpatient rehab, and some people will think it's mainly like drug rehab when I say rehab, and although, like I said, we do deal with people who are all from all walks of life, people who have addictions, may be addicted to already pain medications that they need for chronic issues. We do address those things too. And again, in my particular rehab, we address the whole person. So that includes medical issues, physical issues, but mental and emotional issues as well.
right. Yeah, so that is wonderful. And it's a lot because, like I said, I had a small issue. Well, I don't want to necessarily call it or like reduce it down, but I do understand what it feels like to wake up and not be able to lift yourself up or not be able to move your right hand or move your leg or walk or even talk. I have experienced that feeling, and it was a terrifying experience, and I never want to feel it again. But I did imagine at that time that was the biggest fear of mine was like, well, what if I don't go back to normal? What if I can't ever use my hand again? Or what if I can't ever, be able to paint again or be able to speak again? And so I thought that this was a very important thing to talk about because I know that there are people in the world who have experienced those things and they do need doctors like you all to help them with their physical therapy and also to help them with mental issues that go along with that because of how drastic and life changing it can be. Fortunately, I was able to, regain a lot of my abilities back. I wouldn't say I'm 100%, but I do understand, that it is a process. And so, one of the things that I would like to talk about too is because, well, my condition came because I now know that my condition came because of irregularities in my blood vessel. My blood vessels aren't shaped normally. They're I don't know, I guess abnormal shaped blood vessels. I think it's called FMD. Um, but anyway, the point that I want to make is that um, having I had to change my diet. I had high blood pressure because of my blood vessels. It did increase my uh, chances of having high blood pressure is from what I was explained. But I want to talk to people out there and just give them, and I want you to give us some insight about like what are some preventative measures that people can take so that they're not, if they do have high blood pressure, if they're not eating right, or if they're not, what are some things that people can do just to make sure that they're not in that situation where they could possibly have a TIA or even worse, a physical, a real stroke, for lack of a better word.
Absolutely. Absolutely. Of course, not, like I mentioned, no one plans for having, strokes or being involved in car accidents or falling down and breaking things. But of course, when those things happen, the more you know about what's going on and the way you can sort of manage it and what to expect down the road, that will help ease anxieties. That will let you know the things you need to do to continue to reduce a recurrence of whatever problem that you might have experienced. Of course, the first thing, and a lot of things are what people already know about, but we just don't do. So, and even as growing up in school, we talk about diet and we talk about exercise. Obviously, in this fast-paced world now, a lot of things are, fast food or just easy to get door dashes and all those other things that obviously are convenient but may not be the best options for our health in the long run. Same thing with exercise. We obviously, exercise helps with a lot of things, physically and even mentally. But again, people who work and have kids or just just caught up in the day-to-day activities, sometimes we may feel like we don't have time to do those things. But again, diet and exercise, that works across the board along the lines of a lot of different disease process and injuries. But ultimately, even just going to the doctor, I know we don't like going to the doctor unless something's wrong. But going to the doctor for just routine checks, or like we talk about, preventative maintenance, just to see whether or not there's anything that's showing up in blood work or anything that's pertaining to maybe elevated or uncontrolled blood pressures. But really just being informed and just knowing what's going on with yourself. And then if there is something that's going on, just not really blowing it off and say, maybe I'll feel better the next day or maybe it'll go away, but being proactive, finding out what may be going on. And of course, in the day of Google, a lot of people just will research what they have going on, which can be good and bad, because again, having a little information sometimes can be just as bad as having no information. But again, when something's wrong, going to a professional and actually seeing what may be going on or what may be causing whatever symptom that you may be having so we can get to the bottom of it and then ultimately tailor whatever treatment plan someone needs to what may be going on, if that makes sense.
Definitely, yeah. And I think another thing just to add for me, like I just was very uninformed, and I didn't try to understand because I didn't think it was important. You never think that anything serious could happen to you. Especially I was feeling like, well, I'm young. I never had high blood pressure before, so I'm good. I can eat what I want. I can do what I want. And I never imagined anything could be wrong or would go wrong. But I think just saying to yourself, that you are important enough. We put so many things um, ahead of ourselves. A lot of times when you have different responsibilities, a lot of times you might think, well, work is more important, or kids are more important, or whatever that you feel is pressing at that time is more important. But at the same time, if you don't take care of yourself, then none of those things are going to get done anyway. You have to you put yourself first when it comes to your health and your physical health and your mental health, and just treating yourself well. You know what I mean? So
Absolutely. And can I just add one more thing?
yeah.
Also, a big thing that we'll always ask patients when they come and see is what's your family history? Because somebody might have gone through the same thing that you've gone through, and they may be able to give insight, or you may be able to learn from them as far as the things that they did or didn't do to address whatever may be going on. So again, just talking to people who may have similar experiences and talking to again a professional who should know about what may be going on, that can again help in the long run as far as reducing further problems.
Okay. And so also going back to family, um could you tell us what are some ways, or what ways do you think is best that people could advocate for themselves or advocate for their family members who, if they're in a situation where they can't talk, or, they can't advocate for themselves? What advice would you give to people on learning how to do that?
Yeah, absolutely. As far as being the family of maybe a patient, uh, of a patient, that family member actually being present, especially if a patient can't speak for themselves or just doesn't really know, what to ask or the questions to ask. Somebody being there who can maybe communicate better than the patient to the providers, as far as the nurses, the doctors, whoever, just to make sure you again know what's going on, know what caused it, how do we treat it, what do I need to expect, down the road or even over the next few days or weeks. And really, it's just really asking questions, and and that's what I always do to my patients. What questions do you have for me? Do you have a question about this or that? Do you already understand what's going on? Because ultimately that's what it's really about, understanding what's going on, how we're treating it, and what we need to do to make sure things continue to get better. And so, of course, just because a lot of patients I'll ask, do you have questions? And it's not necessarily that they're, don't have questions or they're not interested. Sometimes they just don't know what to ask because there's a lot of things going on. They just don't know exactly what to ask. So, I try to keep it things as simple as possible, as far as whether or not if you feel good or bad, whether or not you're having, any symptoms. Sometimes people don't have symptoms until I ask them if they're having certain things. But again, just asking questions, and even if is there anything that you think I should know about this or that, for these medications that we're taking. There's just a whole lot that goes into patient care and making sure patients are educated, because ultimately, at least, I see these patients in the hospital, but they're not going to stay in the hospital forever. So it's important for my patients to know exactly what's going on and what to expect when they go home, to make sure that they know what's going on and what to do to try to keep them out of the hospital.
Right, right. And so that's a really good point. And my question is, in the unfortunate case that you are in the hospital or your family members in the hospital and they don't have the questions answered, or they don't really understand what's going on, or maybe they're discharged and they weren't given, clear instructions on what they can and cannot do. Like, when you're in the hospital and you feel like you're not fully understanding, or you feel like you're not getting the care that you feel like you should get, or that you expected, what advice do you give to those people?
Yeah, so of course, one, express that you have concerns or you have questions about this or that. Obviously, the provider should be more than happy to explain those things, to make sure that you understand what's going on. Even provide paperwork or handouts or copies of things, so you can sort of look at it for yourself too. Also, it is okay to get second opinions if you're not sure, or whether or not somebody is not a good communicator as far as what's going on with you and what they're doing to treat you as well. And ultimately, even following up with an administrator who's in charge of the hospital or the office, talking to them to just express how you're feeling, because they may be able to intervene and find somebody who can communicate it better. But ultimately, making sure that you have expressed, whatever concern or question, and making sure you get the answers to those things. Because ultimately, like I said, everybody's different. That means patients, that means doctors or nurses. This is a people business, and so, and these same doctors or nurses might are obviously people before they became that profession, and sometimes it's about who the person is versus the actual profession. So but ultimately, again, just talking to anybody and everybody until you get the answers that you want.
Excellent. Okay, good. And Is there any other information that you feel like is important that we haven't covered that you just feel like it's important that the community know that, you know, they should know?
Well, like I said, I think just being informed and talking to the right people, getting the answers that you need, so you know exactly what's going on and know again what to expect. And so, like I said, questions, doing your own research, obviously taking control of your own health with changes in behaviors or diet, exercises. It could be even a job that you're on that's causing you more stress. This could be a detriment to your health as well. Just thinking about the things that actually make you feel good. And obviously, if things aren't making you feel good or causing you to have some discomfort or problems, making sure you investigate what's going on and obviously ultimately make sure you have a solution so you are feeling better.
Right. Thank you. And dealing with patients, I know that, you deal with different people, patients who are going through, really scary situations where, they're feeling frustrated with their medical situation, they're just mentally kind of like drained or upset. How do you help patients when you come across that? What do you say to those patients?
Well, one, I treat everybody how I want to be treated, and so I will sit down with a patient as if they're my mother or my brother or sister or whoever, and talk to them how I would talk to them, and make sure that, again, one, I listen to them as far as how they're feeling and what's going on, and then ultimately just communicate everything that I know about whatever's going on as far as a disease process, like I said, a treatment plan, prognosis, what to expect, but also just knowing when I don't know something, letting them know that also, and letting them know, I will go and find the answer to their question if there's an answer to the question. But at the end of the day, just making sure, I'm listening to the patient, making sure they feel like they've been heard, and again, making sure we go over each and every problem or each and every issues that they're dealing with, and making sure there's some sort of resolution to it, and making sure they feel like there's a resolution, and making sure we're all on the same page.
Okay, cool. And now I just want to ask a quick couple of questions. I know we're running out of time, but this podcast is really about being get into the real because a lot of people don't like to talk about, their personal stories or things, that they have to do. A lot of times we like to show like the finished product. This is the good stuff, you know what I mean? But we don't, but what really helps people is like knowing like, well, yeah, I've gone through that too, and this is what I do, or yeah, I feel like this too, and this is what I do. So my question for you is like, have you ever felt frustrated personally or professionally, like frustrated, stuck, or stagnant? And if you have, what do you do to bring yourself out of that and keep moving? Because you've done so much. So I know that there's something behind that that allows you to do that. Give us the scoop on how do you do it? How do you do
Ab-
that?
Absolutely. Obviously, I give all credit to the good Lord, Jesus Christ, who's the head of my life. Because without Him, I would not be here today speaking with you. And so, prayer is what I would go to first anytime I'm frustrated, feel stagnant, just because ultimately He will, show me the way and what I need to do, or at least reveal in some sort of form or fashion as far as whether or not I'm on the right path or not. Obviously, if it doesn't feel good, it may not be the right path for me. But at the same time, obviously, sometimes there's pain before there's joy. And it doesn't mean that you just quit or give up anytime, there's some sort of challenge or adversity. It just means that you will appreciate where you've come from after going through that. And then also, again, just, being grounded and spending time with, the people who know you and love you the most as far as your family. Like I said, I have a wife and two kids, and they are my world. So I spend a lot of time with them, and they, at the end of the day, continue to affirm as far as why I'm doing it and getting up every morning. But of course, like I said, I've wondered, am I still doing the right things? Is there more to my life? Is there anything else I need to be doing? But like I said, and there may be, but I step back and let the Lord take control. And if something He wants me to do, He will make me do it or show me how to do it.
Right. Okay. So, and the last question of the day um, is there any advice that you would give to anybody out there who is feeling, stuck and stagnant in their life, in their career, their medical situation? Anything you have for those people?
Yeah, well, of course, like I said, for myself, I would encourage you to pray, get connected if you have not been connected. Ultimately, do something different. Sometimes people need a change, and sometimes you have to get out of your comfort zone to get that change and to obviously get to where you need to be. But of course, setting goals, writing things down so you're organized, because again, the brain will take you all sorts of places, but if you can actually organize your thoughts and can sort of see your plan, that will help keep you sticking to the plan, as to say. But again, like I said, if you're feeling stagnant or frustrated or just not happy with things, do something different. And like I said, explore your options. And again, talk to other people who may be doing something that you're not doing or the same thing, just to get their thoughts on how they did it, and of course, what their path was as well. But again, obviously, love yourself, as somebody told me a long time ago. And if it's not making you happy, do something that is going to make you happy. Because again, put yourself first, like you mentioned earlier.
Yeah. Okay. Well, thank you. All right. So if you have any questions, you can email us at Amanda Downs at creativelegacyart.com, and I will ask any questions for you and get back to you on that. I just want to thank you so much for coming on the show, giving us your time and your expertise, and just really helping us in the community to understand about health and what steps we can take to a better journey, what steps we can take to get in the life that we want and we deserve. So I just really appreciate you and thank you so much.
Thank you for having me, and always good connecting with you.
Thank you for joining us today. This has been the Creative Legacy Art Podcast. If you like this video or this podcast, go ahead and follow us, join, subscribe, and do all the things. If you want to like or share, that helps us to get the word out and grow as a community, and we really appreciate it. You can also follow us on our Instagram page at Creative Legacy Art underscore podcast. And of course, you can follow us on Instagram at Creative Legacy Art Podcast. Thank you so much. Have a great day or night. And remember to stay strong, stay positive, and keep creating.